So in the previous video we have just left with this one diagram, which was the basically systematically when you are giving the drug, or either you are giving locally. Okay, so this diagram is very important to understand to okay, so let's start it. Bismillahirrahmanirrahim. You can see there are two diagrams. Okay, on your left side there is a diagram that is showing that when a drug is given, it is moved it in the GIT. Okay, we know it. There was a medication which was taken orally by a patient. That drug moved it into the GIT. Okay, in the GIT, then it is transported to the portal system. Okay, into the portal system, so it entered into the liver. Okay, from the liver it enters into the circulatory system. Okay, from there it moves into a circulatory system, and then it moves to the periodontal pocket. Okay, in which the drug was quickly eliminated from the pocket in the oral cavity by gingival clavicle fluid. So basically when the drug entered into the pocket, so through it was quickly eliminated due to the flow of the gingival clavicle fluid, because the locally administered drug was not in a control release formulation. It was not in a control release matlab it is not in a control form, due to which it suffers. Then means it is a systematically, they have given here a systematically approach. But if they have did with the local also like this, the local will be always all will also have the same limitation. On the right you can see this diagram. Okay, on the right, when they are locally delivering the control release of antimicrobial agents, it is directly moving into the periodontal pocket, where it remains until it degrades. It basically the medication or the drug is present in the pocket until it degrades, and continuously releasing the drug into the gingival clavicle fluid over that time. Okay, so because of this drug may be will be active against the plaque bacteria that have invade the surrounding periodontal tissues. Okay, so they are saying when you give in a control release formulation, it stays in that place for more time. Okay, and it is more effective against that bacteria that is attacking or invading the surrounding tissues. Okay, now moving towards the locally rationale for the local administration. Now, why you give local? In the previous video, I have told you that the rationale for systematic drug administration was number one, to control the bacterial infection, number one, and number two, it was that protect the tissues, because due to that there was a substantial or essential amount of tissues were traumatizing. Okay, the third point is the through the bacteria which is inaccessible by the mechanical instrumentation, so we approach those bacteria. Now what is the rationale for the local drug administration? So basically it is directly into the pocket, which I have told you. Then the potential for the greater concentration directly into the infective area, it is given in the pocket. Okay, in a greater concentration, then it moved it towards the infective area, then it reduced the systematic side effects. Means the systematic side effects were what we have told you, that it moves in your GIT, in the GIT, then it moves into the liver and then into the circulatory system, so their viability also decreases. You have studied in your pharmacology. So that way when you give locally and it also in a controlled formulation, it is more effective against the bacteria. Okay, so basically you give in the pocket in a great concentration, it moves to the infected area, it reduces that side effects, also this reduces the possible systematic side effects that is occurring. Number one. Okay, Then ideal properties for any antibiotic. What is the ideal properties? The ideal antibiotic for use in prevention, it should be preventive and treat the periodontal disease. Okay, specific for periodontal pathogens. Which periodontal pathogens you have? Porphyromonas, you have gingivalis, then you have Provatella intermedia. Okay, you have agrarobacters, parochides, filaments. Okay, allergenic and subtative. Okay, so it should be the like this. Okay, it should be allergenic also. It should be subtative and not in general use for the treatment of other diseases. It should be specific for the bacteria. Okay, and it should be inexpensive, very important, so everyone can take them easily. Currently the ideal antibiotic for the treatment of periodontal does not exist. Okay, although oral bacteria susceptible to many antibiotics, not a single, means they are susceptible to many antibiotics, not more, but a concentration which is achieved in the body fluids inhibit all the potential periodontal pathogens. So they are saying that bacteria are susceptible to many antibiotics, just not one single. We all know it is achieved when the your body fluid, that concentration, so it kill all the periodontal pathogens. Okay, indeed the combination of antibiotics may be necessary to eliminate all the potential pathogens from some periodontal pockets. Okay, then what problems do you have? Problems with antibiotics. Some people can have allergic or anaphylactic reactions, superinfections of opportunistic bacteria. Okay, it can harm your microflora. Okay, it can develop the resistance interactions, even the drug interactions with other medications. It can upset your stomach and vomiting and nausea. Okay, it can be some drugs like how you have penicillins and cause hypersensitivity. Tetracycline causes the staining of the teeth. Okay, and many drugs can cause your GIT problems a lot. Most adverse effect takes the form of GIT. Yes, most adverse effects are most common is GIT. Okay, others concern, you can say, the cost of medications and the patient is taking or not, and the ability to comply with the purpose, means it is fulfilling that purpose of not. Is you know patho you have done it. So the overuse or misuse of this or widespread of prophylactic application of the anti-infective drugs are some of the factors that have lead to emergency resistance. Yes, sometimes what when any medication, you can say, when it is used for a very prolonged period of time, it adapt a resistance against that bacteria. Okay, that's why biofilm protect the bacteria from antimicrobial agents. Okay, so it is one of the protection for bacteria. So always remember, when a patient has biofilm, first you have to remove that biofilm, then you will subscribe the antibiotics. Without removing the biofilm, you will not subscribe any antibiotics, or well, you have to remove the plaque biofilm. Okay, that deposits, because it will does not allow the or it will not inhibit the growth of bacteria. So you have to remove the biofilm and plaque, etc.